47-year-old man with alcoholism presents to office for a 72-hour history of intense right side chest pain. He also reports 2-week history of fever, chills, diaphoresis, and persistent coughing with abundant malodorous sputum. Chest X-ray shows round consolidation with air water level in middle third of right lung. Sputum sample is sent for analysis and results are pending. Which of the following is most likely diagnosis? Bronchiectasis, bronchopulmonary sequestration, lung abscess, tuberculosis, lung cancer. So yeah, so what happened? This patient, he's alcoholic. Since 3 days, he's saying that I'm having chest pain, I'm having a lot of fever since 2 weeks, and then he's producing a smelly sputum on cuff. And you decided, okay, let's do an X-ray for this patient, and you found a round consolidation, and it had air fluid level. Basically, there's a cavity which had air and fluid, and you send a sputum sample for analysis. Which of the following is most likely diagnosis? So most of you answered correctly as lung abscess. Let's move on and see and read a bit more about lung abscess. So first of all, let me show you a figure of lung abscess. So this is chest X-ray. Whenever they would want you to think about lung abscess, and they will give you, if they give you an X-ray, they're surely going to show this air fluid level. So this is our cavity. This line is fluid level, this line is air level. Basically what is going on here is, basically there's a cavity formed due to all the necrosis, and there is liquefactive necrosis, liquefactive degeneration, formation of pus, formation of inflammatory material, and all that forms fluid. And since this is a cavity, there's going to be air. So the bottom part is going to have fluid and the upper part is going to have air. The fluid is basically all the inflammatory material and pus. Now, this was a very interesting question, like interestingly framed question, because it gives us a lot of points about a lung abscess. So I'm going to read through the question and tell you what all is important about lung abscess. So this patient was having alcoholism. Alcoholic, any patient who has altered mental status, any patient who has problem in swallowing, let's say has dysphagia, they are prone to lung abscess. Basically, what in such patient what happens is the swallowing mechanism is a bit altered, and they aspirate either their oral secretion or their gastric fluid or something like that. In normal case, you are not supposed to aspire your oral secretion. By chance, if you try to aspire, your cough reflex is going to act, and you're going to just cough it out, or yeah, so you're just going to cough it out. But in alcoholics, in chronic, like in really bad alcoholics, or person who is in altered status, let's say he had a stroke or a seizure or something like that, or in patients who have dysphagia, let's say some achlesia or esophageal problem, in those the cough reflexes is a bit problematic, and they aspirate either their gastric secretion or oral secretion. So alcoholic is an important point to remember. Then he started developing chest pain. Chest pain can be seen in a lot of a lot of lung conditions, so this was not very specific. He has fever, chills, and malodorous sputum. This is very, very specific of lung abscess. Whenever you see malodorous sputum, you should somewhere in your head think of lung abscess. And then there's a round consolidation with air fluid level. So once they say there's a consolidation and there is air fluid level and that's present in lung, like the diagnosis for Usmle is confirmed to be lung abscess. So this is an important point to remember, and it's present in middle third of lung. It's super important because what they're trying to say is, so there are certain dependent areas of the lung. If I am someone who is bedridden and I'm lying on the bed forever, in that case, in that condition, what is going to happen? Whatever I aspirate, it is going to go in the posterior part of lung. That is going to become the dependent part of lung. So if someone is lying on left side for a long time, in that case, a dependent part is going to be this part. If someone is lying like supine, then the dependent part is going to be posterior part. If someone is having is not unconscious but having dysphagia, and he's sitting, and in sitting position he is having aspiration, then the inferior part of lung is going to become dependent position. So basically important thing is that aspiration, if the lung abscess is due to aspiration, it is going to happen in dependent part of lung, depending on which condition your body is right now.
Thanks for watching. Please give a thumbs up and subscribe for more.